Thank you for ordering the Kylos test. The following message is specific to those with a negative result. A negative result on the Kylos test indicates that known harmful changes were not found among the genes that were tested. Although the result did not indicate an increased risk to develop cancer, it's important to recognize the limitations of this test. First, a negative result on this test does not mean that you will not develop cancer. Each of us has a baseline risk of developing various types of cancer, and no one's cancer risk is zero. Your specific risk to develop cancer depends on many factors, including age, gender, medical and family histories, and lifestyle characteristics. Although a harmful genetic change can serve as a risk factor for cancer, not having such a change does not mean your risk of developing cancer is decreased. Second, the test did not look for changes in all genes associated with cancer. There are likely genetic risk factors that cannot be identified using current testing technology. Because of these limitations, it's important to remember that a negative result from this test does not prevent you from being an appropriate candidate for other genetic testing in the future if your healthcare provider recommends it. It's important to recognize that even with a negative result, you may be at increased risk to develop cancer based on other risk factors not identified using this test. Red flags in your family history would include rare cancers, cancers that develop before age 50, multiple separate types of cancer in the same family member, and multiple individuals on the same side of the family with the same type of cancer. If you or your healthcare provider feels that your family and/or personal medical history may indicate a cancer risk higher than that of the general population, you might want to consider seeking a clinical appointment with a genetic counselor that specializes in cancer. A genetic counselor is an individual specially trained in both genetics and counseling skills that can tailor a risk assessment for you in the context of your family and medical histories. Regardless of the result of this test, you still need to speak with your healthcare provider about screening recommendations, such as mammograms and colonoscopies, as well as changes to your family and medical histories. Your report may also include one or more gene variants of uncertain significance. This simply means that at this time it's unclear whether the variant is benign or has an impact on cancer risk. Thank you again for ordering the Kylos test. I hope this information has been helpful for you. For questions or to learn more, contact your healthcare provider or Kylos Genetics.